I'm about to go in to carry out the physical assessment for my patient. So I sanitize my hand and knock and maintain patient privacy. Uh, Good morning. My name is Janet Akiwumi. I will be your student nurse today.
Good morning, Janet.
So I'm here to perform physical assessment that has to do with your head, your neck, your face. Are you comfortable me doing that for you now?
Yeah.
Oh, okay. Thank you so much. Can you tell me your name, please?
Oh, my name is Tululope Okiwumi.
Okay, Tolulope. I will start from the head. From after head, I'll go down to the face, check your eyes, check your nose, your mouth, then your ear and your throat. Okay?
Okay.
So let's start. Let's begin with the head. So the first thing I will do is to carry out the inspection, looking at the shape of the skull, the scalp, your hair. And I can see that your hair is full, is well distributed, and everything look normal. And after that, I go into palpation, where I will check the lumps, whether there is any lumps, whether there is any bruises, any bumps, any depression, any contour. So that is what I'm doing next now. Okay, I can feel the scalp, and I see everything. There's no bumps, there is no lumps, there's no, or even I go to the occipita, the back of your hair, there's no contour and no depression. Everything looks normal. Okay, to the look.
Yeah, thank you.
Okay. After that, I move down to your face. I'm moving down to your face, and I will start by inspecting the shape of your face, the symmetry, and looking whether there is any involuntary facial movement, whether there's any scarring, any lesions, looking at the eyelashes, whether there's any crossing, which I say everything looks normal. And the next thing is to palpate. I will start from by feeling your temporal pulse, which is sounding very well. Then I move down to temporal mandibular joint. And can you open your mouth for me, please? Okay, close it. Open it again. Okay, good. Okay, I'll be moving to your sinuses, palpating the frontal sinuses. Okay, I'm moving down to the maxillary sinuses. Do you have any pain or pressure?
No.
Okay, good. So, looking at your eyes, the eyelashes, everything looks good. And your eyes, the sclera, white, and that's good. There shouldn't be any yellowish or jaundice. Then pulling the lower eyelids, is the conjunctiva is nice and pink, which is very good. It's not pale. That's how it should be. That's nice. Everything about you look good. Okay.
Thank you. Yeah.
Thank you. Okay. Next is your mouth. So I will start from inspecting your lips, checking for any cracks, any articulations, or sores, which I look at it, everything is perfectly okay, no cracks, no sore, no lesions. The next thing is for you to please open your mouth for me. Okay. I look at the quality and the movement of the tongue, also the color of it. Everything looks good. Okay, I'm looking at the back of your throat. Okay, your tonsils and your uvula, everything, there's no swelling, everything looks good. Okay, from there, checking your hard palate and your soft palate, everything is okay. Okay, I'm pulling your lips a little bit. I'm checking your teeth, the gums, the down one, the gums. There is no discoloration, no lessons, no soreness. Everything is okay. Okay. Before I finish the mouth, I want to feel the submandibular dot and parotid dot. Okay. Okay, I can see that. Lift up your tongue for me. Okay, the sublingual. Okay. Okay, everything looks good. There is no induration, no mass. Perfect. Everything looks good in your mouth. You don't have any pain anywhere?
No.
Perfect. Next is the neck examination. And I will start by inspecting the neck. I'm checking for the symmetry and looking at the trachea, whether it's in the midline, and also whether there is any marks, scars, or lesions, which everything looks so good. No scars, no lesions. And the next thing is to palpate your navel load. And what am I checking? I'm checking for the size, for the shape, for the mobility, for the delimitation, for the consistency, at the same time whether there's any tenderness. I'm starting from the preauricular, and I will be using either my 2 or 3 fingers, using the palm of it to palpate. So the preauricular, lymph node, then to the posterior auricular lymph node. Then I move down to the submandibular. Then the next is submental, which is directly under your chin. Okay, from there I move to the superficial cervical chain, then posterior cervical chain, anterior cervical chain, and the deep cervical chain. But can you please turn your head a little bit? For me to feel this very well, I have to press the sternocleidomastoid muscle to be able to palpate well. Okay, good. Turn back. And the next thing is supraclavicular lymph node, which is directly above the clavicle. And going to your back to palpate the occipital lymph node. Okay, with this, I can say that your lymph nodes are small, they are not tender, they are mobile, which looks so great. Okay, the last part of this examination is the thyroid gland examination. And as I've been doing from the beginning, I will still inspect, checking whether there's any goiter. Okay, it looks good. And the next thing is to palpate. I will do it 2 ways. I will do it posteriorly and anteriorly. Can you shift a little bit for me? Thank you so much. I will put my hand around my patient's neck below the isthmus to feel the cricoid cartilage. Okay. And I will ask you to swallow for me, please. As you swallowed, both the thyroid gland, thyroid cartilage, and cricoid cartilage rise together with the swallowing, which sounds good. So let's move anteriorly. Anteriorly, I'm pressing from side to side, side to side, feeling whether there is any enlargement of the lobe. Also, whether there is any lumps or bumps, nodules, or tenderness. This might be a little bit difficult for you. Okay. And I want to know whether you are experiencing any pain, any tenderness. Do you have that?
No.
Okay, go. Okay, while doing that, I'm putting my right fingers, palpating laterally for right lobes, finding the lateral margin. And with my left fingers, I'm palpating laterally, finding the left lobe, noting the size, the shape, the consistencies of the thyroid gland, and identify whether there is any tenderness or nodules. So, if there is any thyroid enlargement, I can use my stethoscope to listen to the brood. And with you, I can't hear any brood. Everything looks nice. The thyroid are not enlarged, and I don't see any gutters of nodules.
Thank you.
Oh, thank you for allowing me. This is the end of our assessment this morning.
Thank you.
Thank you for your time.
Thank you.
Stay
Thank
blessed.
you.